Welcome everyone, this is Dr. Ben. Welcome to Bio 202. We're going to go over the heart today, okay? Showing you all the location of these things of the heart that you need to know for your practical, okay? So again, I have two hearts here. You have the bigger one and the smaller one. Big one, again, is the white base, and then you have the smaller one that is actually a green base, okay? So you definitely will see the questions on both of these hearts, so I want you to be familiar with it, okay, on both of them. The first thing you want to, again, to know is to orient them and making sure you know which side is which, okay? So again, you want to know whether is it upside down or is it back-sided you're seeing, so you should be aware of all of the nooks and crannies. So you know, before you could even answer the question, you need to know which side kind of oriented to the correct side before you answer. Otherwise, you're gonna have it incorrectly. Okay, so make sure you're aware that you're seeing this right here, that running down, that's the front side. When you see a little T like this with a big hole in the back, so that's on the back side, okay? So this is the left, this is the right. This is the right, this is the left, okay? If you're seeing in the front, this side, which is your left side normally, is the right side of the heart, and this is the left side of the heart, okay? Normally your right side. But then when you see things in the back, it's the same side. If this is your right, then this is the right, and this is the left side of the heart, okay? So beware of that, okay, before you think about anything else. Again, first you need to know this is the base, okay? The base of the heart is basically without all of these arteries and veins, okay? So the base is right on the top, the apex is right on the bottom here, okay? Base on the top, apex on the bottom. The first thing you need to know, this right here is superior vena cava. Superior vena cava. If you look from the front, you're going to see a little bit right there. So better to see it on the side like this. That's superior vena cava on the side. Okay. Same thing with the big one. You have this right here. You have two prongs. Just know the first prong is superior vena cava right here. Okay. This is superior vena cava. The first prong. Okay. Next one is the inferior vena cava, which is big hole here in the back. Same thing with the big heart. You're going to see a huge hole in the back as well. That's the inferior vena cava. Okay, inferior vena cava. So understand those two. Okay. Then you have the right auricle. The right auricle is right there, little flap. Okay, in reality, it's this little flap of the right side. Again, knowing the right side of your heart. Look for that pulmonary trunk, look like a little tree coming out, the blue coming out like a little T. You could see right here, it's resemble a little letter T. So think of that pulmonary trunk. That's the front. You have this arch of the aorta, so that's the front as well. Okay, so that's what you want to see, the T here and the arch. So that means it's the front. So if that's the front, this is the right side of your heart. This is the left side of your heart. So this is the right auricle. Okay, this is the right auricle. It's A here. The right auricle is IA on this one. Okay, IA on this one. So this is the right auricle. Okay, and then you have the pectinate muscle. So we're going into the atrium, the right atrium. This chamber is the right atrium, right here, right atrium. So the pectinate is the flooring. Okay, the flooring of the right atrium, which is right here. This is the flooring of the right atrium. Okay, and same thing, you could see that with this small heart. Okay, let me open it up. Okay, so if you open this up, okay, the flooring of this one will be on this side. Looks kind of like an ear. Okay, the ear mark. Okay, that's the right side of your heart. Behind that, that's right there is the pectinate muscle. Okay, knowing that's the pectinate muscle. So again, to find a big one is right behind the top part. That's pectinate muscle. Look like Freddy Krueger skin. Okay, I'll put it on the side here on the top. Okay, so here is your right atrium. This is the right atrium, this chamber, and this chamber is the right atrium right there. Okay, both of them, there's the right atrium. Okay. And then what you want to look at is the fossa ovalis. Let me see, with the light, you could see that like little moon crater in here. That moon crater is the fossa ovalis. Okay, that little moon crater you could see right there, fossa ovalis. In the smaller one, okay, it's the white area, this white little area right here. Okay, that white area, let's see, focus. Okay, that white area, that's the fossa ovalis in the small one. Okay. And then you have the opening of the coronary sinus. Opening of the coronary sinus is this red area right here. Okay, this little red mark, that's the opening of the coronary sinus. Obviously the coronary sinus is in the back. Is this guy here, let's say A, that's coronary sinus, and it goes into the right atrium and opens up right there. Okay, so look for this little red mark. Okay, for this one is this little red mark here, that's the opening of the coronary sinus. Okay, opening of the coronary sinus. Okay, next one you have the tricuspid valve, which is right there. Okay, tricuspid valve right there. Okay, say letter E on the small one. For the big one, you have to take out the front like this, and you're gonna see a nice little number 3 there is the tricuspid valve. You have 1, 2, and 3. You could count the cups. You have 1 right there in the front, 1 right there on the side, and another one right there. So tricuspid. Okay, just know that it's on the right hand side. Don't rely on counting, because a lot of time these models may not be fully in working condition. Some of them might be a little bit damaged, so don't rely on that you're going to have 3 cups. What you could rely on is when you look at this, look at the wall here, you're going to have a thin wall versus the thick wall on this side. Thin wall, thick wall. So when you see the thin wall, you know this is the tricuspid valve. Again, thin wall, tricuspid valve on the right side. Okay, so that's what I want you to look at, what I want you to be aware of, knowing that this is the thin wall, therefore this is the tricuspid valve. Word that you definitely need to know, you're going to see this on your practical for sure. This is called the chordae tendineae. These little string, the string itself, chordae tendineae. These strings here, chordae tendineae. Okay, you have the papillary muscle, number 2, right there, and number A. It just say A right here, papillary muscle. Okay, papillary muscle. The chamber here is called the right ventricle. Okay, right ventricle. Again, right ventricle, this little chamber here. Okay, right ventricle. The flooring on this and the flooring on that is called trabeculae cardiae. Trabeculae cardiae, right here. Okay, these flooring on both right and left ventricle, they have that. So it is trabeculae cardiae. Okay. Oh, sorry, trabeculae cardiae. So that's the flooring. That's the flooring. Okay, so you have both flooring there on both sides. Again, trabeculae cardiae on this side, trabeculae cardiae on this side as well. Okay, you have the right here, the wall in the middle. The wall in the middle, we called it interventricular septum. Okay, interventricular septum right in the middle. Same thing with this one. This is right in the middle, is interventricular septum right here in the middle. Okay, right here in the middle. Going out is the pulmonary valve, pulmonary semilunar valves right there. Okay, same thing with the small one. Going out, you have the pulmonary semilunar valve. Okay, You could see this little thing here. It's not on your list, but this is called a moderator band. Moderator band. Everything else kind of going vertically. This one kind of going horizontally. And the only place you find this little band is actually on your right ventricle. Okay, no other place in your body that actually have this right here called moderator band. So only on your right ventricle that actually have that exist. Okay. You can't really see it on this one. I don't think they have one here. I was just looking at it. There's nothing really here to show moderator band. Even on the back side of this, you can't really see the moderator band. But you could see the trabeculae catenae really well on these two sides. Okay, trabeculae catenae. Again, if you have to orient yourself, this is the front. This is the front pointing down, which is the apex. So this side is the right side. So if you flip it over, this is the right side. This is the left side. Okay. So right, left. Okay. So this is like seeing the back. Your left is left. Your right is right. Okay. So now we're gonna go to deep. Since we already did the pulmonary valve, the next one is the big T right here. This big T is called the pulmonary trunk. Pulmonary trunk. Again, right here, pulmonary trunk with the big one here. Okay, number 4. Okay, pulmonary trunk right here. Okay. And then you have this side is the left pulmonary artery. Okay, left pulmonary artery on this side here. Okay, and then on the other side is right here. This is the right pulmonary artery. So if you put your probe through, okay, put your probe through. So this is the right, I'm sorry, this is the left. This is the right side. Okay, it comes out on the other side. Same thing with this one. You cannot put the probe through, but this is the left side. Left pulmonary trunk, and these would be the right pulmonary trunk on the back. Okay, so and then the blood goes to the lungs and then come back. This would be the left pulmonary veins, these two, and these two, if you look in the back, these would be the left pulmonary veins. These would be the right pulmonary veins. Looking at from the back, you could see the back like a T right here with the big hole. Okay, big hole T. That's the back. So therefore, this is the left side. This is the right side. So left pulmonary vein, right pulmonary vein. Same thing with this. Okay, big hole in the back. Looking from the back side, big T. Okay, you have the left pulmonary vein and right pulmonary vein on that side. Okay, and coming back to the heart. Okay, coming back to the heart with those those veins. Okay, then you have the little flap on the outside. This brain kind of look alike. Little brain thing here. This is the left auricle. Okay, this is the left auricle. Okay, the left auricle on this one is right here. This little flap right here. Little left auricle, whatever that looks like. Okay, so that's the left auricle. Okay, and then if you look at these, this would be the left left atrium. So this is the left atrium. Okay, where the blood comes back in. Okay, left atrium, blood come back in right here. Okay, so left atrium right here. So on the big one, you can't really see it, left atrium, unless you take out the back, and this would be your somewhat like a left atrium right here. Okay, left atrium in this little chamber here. Okay, you could see the opening of the fossa ovalis on the other side. This is your left atrium. Okay, chamber here in the back. In reality, the atrium are very small. Okay, very small. Okay. Next one is the valves. You have right here on the right, these are the two flaps, so 1, 2. So this is a bicuspid valve, so bicuspid, or mitral valves right here as well. Okay, same thing. You have the mitral valve, which is H here, a bicuspid valve. Okay. Again, papillary muscle, chordae tendineae, same thing, like on the other side. You also have the left ventricle. This chamber right here is the left ventricle. Okay, this whole chamber, left ventricle. Same thing with here, left ventricle. So look again, what side are we in? This thick muscle, thick wall right here. So that must be the left side. So left side, left ventricle. The valve that's going out next to the left ventricle is called the aortic valve right there. Say K, aortic valve. Same thing with this one is aortic valve right there. Okay, right there, that's aortic valve. Okay, and then you have the ascending aorta right here. Going up is ascending aorta, aortic arch. Okay, aortic arch right there. This is where I tell you to use the mnemonic, know your ABCs. ABC, A would be aortic arch. Okay, aortic arch is your A. Your B is, interestingly, it named A, B, and C as well. A is aortic arch. B is brachiocephalic artery. Brachiocephalic artery. And then C is the left common carotid artery. Left common carotid artery. And then this one is S, is left subclavian artery. Left subclavian artery. Okay, and then you have this is supposed to be descending. If you write down descending or thoracic, either one, thoracic aorta or descending aorta, I'll accept both. Okay, descending aorta or thoracic aorta is fine. You have right here is the ligamentum arteriosum. Ligamentum arteriosum right there. This little white piece right there. Same thing with this one. You have this little white marker on there, that's ligamentum arteriosum. You have going up is the ascending, right here, ascending aorta, aortic arch. You have the three prongs, brachiocephalic, left common carotid, and left subclavian. Okay, going down you can't really see it. We won't ask you on this one because you can't really see it. We're going to ask you on this one. This is the thoracic or descending aorta. Okay, descending aorta. Okay, and okay, so we have a few structure before we go cover the all the arteries. Okay, so we have a few structure. The white here, the white and blue, this is the trachea. Okay, white and blue is the trachea right here. Then you have the right, this is the right side. This is the right bronchus. Okay, right bronchus, primary bronchus. And this little peak here, this is the left bronchus. Okay, technically is right primary bronchi. Right primary bronchus. This is the left primary bronchus. Okay, right there. Okay, so you have right and left here. Okay, right and left primary bronchus. You also have the brown color here. Okay, the brown color is your esophagus. Esophagus, esophagus. Some people say esophagus right here. This is where your food tube goes to. Okay, your food tube goes into. Okay, and again, you can't see that any of those structures here in the small one. You only see in the big one, so I would focus on the big one. Okay, and we're going to cover the arteries that actually coronary artery around the heart. Okay, you have these coronary artery around the heart, so let's cover those. Might be easier to see. Some of them might be a little easier to see without it. Okay, so let's start with the looking the big model right here, you have the ascending aorta right here, ascending aorta. Coming out on the right side, this is the right side, again front, this is the right side, this is the left side. So this is the right coronary artery, right coronary artery right here, okay, right coronary artery, okay, these little red artery right here, so that's the right coronary artery. Okay, and then you go on the side here, okay, you trace this to the side, okay, right coronary artery coming out, tracing that middle way, halfway back, you could see right on the side, okay, not to the back yet, just on the side here, this one here, this is called the marginal branch of right coronary artery. You could just call it marginal artery. Okay, I'll accept with marginal artery, that's fine, marginal, okay, on this red color, okay. So going right coronary artery, comes down, take a turn, once it take a turn, it changed the name, become the marginal artery, okay. And it keeps going back, that marginal, this right coronary artery going back, and then become in the back, that T in the back, you could see there's a T, big huge hole right in the back. This going down in the back, we call it the posterior interventricular artery. Posterior interventricular artery, okay, so that's the T in the back. Okay, so that's conclude the right side. And same thing, you could see that on this one here, you have the right coronary artery, a tiny little stub right here. This little tiny stub is the right coronary artery. And if you trace it on the side, okay, trace this on the side, so the right coronary come over here, okay, and then it goes. Well, this one doesn't see the marginal, there should be one on the side, but could be this one here, this would be the marginal artery. And then you could see the one in the back, that would be the posterior interventricular artery, this one here. So right underneath the big hole, the inferior vena cava, you have the posterior interventricular artery right there, okay. Let's see, next one. Now we're going on the right side. Right side you have the coronary, on the left side. The left side you have the left coronary artery, which is this little spot here before it bifurcated, before it actually split. This is called the left coronary artery, okay, left coronary artery. When it comes down to the front, that's the anterior interventricular artery. Anterior interventricular artery right here, come down to the front, okay, and that's also known as widowmaker. For this one, you're gonna see this little stub, that little stub is the right coronary artery. That right coronary artery, which is, you could see from the back here on this back side, come down to the front one becomes the anterior interventricular artery, AIA. Okay, once it go around on the side here, that number 5, that's the circumflex artery. Same thing with the big one. Once it go on the side, you could see that side here, okay, right there on the side, it actually has a number, okay, harder to focus and see, right there, okay, right there. So that's the circumflex artery, okay. And then you have the two sulcuses. The two sulcus. You have the anterior interventricular sulcus right here, anterior interventricular sulcus right in the middle here, and the other sulcus is the coronary sulcus, which is right here on the side. Okay, right here on the side. Okay, this basically sulcus means dip, okay, a dip. So you have those two dips. Okay, last part, okay, you have the vein, which is the coronary sinus right here, coronary sinus. Going around on the side, that's the great cardiac vein on the side here, great cardiac vein. You have the middle, which is in the middle cardiac vein right here, and then a small cardiac vein on the side. Okay, so you have coronary sinus number 10, great cardiac vein, middle cardiac vein, and small cardiac vein. Okay, same thing with this one. Okay, same thing with this one. You have the coronary sinus, great cardiac vein on the side. Okay, on the left side. On the harder to see on the right side, not a lot here. So you have a small cardiac vein on the right, this side here on the right, really almost underneath the right atrium. And then you have the middle one, is middle cardiac vein. Okay, the blue. Okay. So that's pretty much conclude the and you have, I think, the posterior, the ascus vein. Ascus vein is basically, ascus vein would be right here. Okay, this is the ascus vein. You look for the superior vena cava right behind it. Okay, that little hole right behind it, that's the ascus vein. Okay, posterior of the superior vena cava. So ascus, superior vena cava here, you could see in the front, superior vena cava. Right behind it, there's a little stub. That stub is called the ascus vein. Same thing with this one. Okay, superior vena cava in the front. These little tiny stub in the back, that's the ascus vein. Okay, so that's conclude this video. Thank you so much for watching. Have a wonderful week. If you have any question, please feel free to let me know. I'll be more than happy to answer or clarify some of these structure with you. Okay, thank you so much.